From Birmingham Drug and Alcohol Partnership. The aim is to collectively work towards reducing the overall public health burden of substance misuse and improving the well-being of affected individuals and communities. These are the objectives that we have that relate to the focus area of data and evidence. I won't be able to let anyone else in, so if somebody could for me, that'd be great. Thank you. Our objectives, like I say, that relate to the data and evidence area are to ensure that we get the best quality out of our data. What we collect is ethical and used in compliance with data sharing agreements. The purpose is to foster innovation, empower improvement, and for us to create stronger partnerships and collaborations across organisations, institutions, and stakeholders. So as I said, this is a focus area for us as the partnership, and that is data and evidence. Data and evidence is broad. At the moment, we will only be talking about our quantitative data. Evidence we also cover is some of the research programs that go off in this area and some of the research that we bring to there. So who do we include in the focus of our data and evidence? So it's the police, the ambulance service, hospitals, the ICB, our recovery support services, community safety partnership, CYP services, social care, and housing. As such, I have not touched on them there, but it goes without saying, drug and alcohol providers that we commission are already quite included in our focus area. As we have a contract with them, we have a data sharing agreement in place. So we as a team have assessed the how we want to improve data accessibility and sharing. And what we've identified as a gap when we started building this dashboard was being able to access shareable police intelligence, the complexities of some of the coding of hospital data, the data lag between when data is uploaded and when we can analyze it to be able to measure those performances. Some children and young people's data goes without saying that obviously children and young people's data is protected for a reason. And as such, some of that data cannot be included or it's very hard to attain as to which organisation it sits with. NDTMS data, and that's the inability to share some of our most recent data that's on NDTMS. And for those who are new to the core, NDTMS stands for the National Drug Treatment Monitoring System. So what are the benefits of having a dashboard? Why are we doing this? So it displays a range of different indicators, measuring our outputs and outcomes related to the priority areas. It highlights areas of improvement and we can visualize the risks across Birmingham. It enables us an assessment of progress, which is benchmarked against England and other core cities. It shows statistical significant differences and demonstrates positive or negative changes. And I'm going to hand over to our analyst that have built the dashboard so he can present this slide.
I'm here. Okay. Yeah. I'll just very briefly talk through this data flow diagram. So some of our data came from MLCSU, which is the Midlands and Lancashire's clinical supporting units, where I can access their data warehouse. And I can pull data like death register to calculate some of these mortality indicators. And also I've got access to SUS inpatient admission to calculate like hospital admission due to drug misuse or like alcohol related condition as well. And I've also got data from NDTMS where most of them are like unmet treatment need prevalence and other indicators, you name it. I've pulled it from NDTMS, but the thing is I can only pull it manually because their system is quite not very friendly to me. So I think everyone have used, you have to download it manually from their Power BI dashboard. And then census data, I've used census data of their population structure of each ward to calculate directly age standardized rate for some of these indicators from the census data. I've also got a fingertips API. So some of these indicators that displays as core cities are pulled from fingertips API. And if it is calculated as ward, then it's from such inpatient admission or death register. And all of these data are then pre-processed in a software called R. And then after that, I will be able to pull a very nice and neat data frame and put it into the Power BI dashboard and visualize it. So should I, yeah.
Do you want to share your screen?
Yeah, should I share my screen instead? Yeah, it's up. Is it on the screen?
Yes.
Okay, nice. So this is the dashboard we have been building. And so the main features is the summary thing. So I will just go through the summary. The summary page will show you the latest available data of each indicators, where you can select your indicators and chapter to navigate through and substances. And Candice mentioned earlier that the benefit of the dashboard is that we allowed statistical significance comparison, benchmarking England. So I've got this hypothesis testing thing here, which shows you that for these indicators, comparing to England, Birmingham has no difference with England, because the difference from target is only very low. And then we also got different substances that you can select to look at, or age group as well, or gender. Yeah. And then if you want to look at the trend instead of just the latest available data, then you can navigate through different chapter. Let's say, yeah, if you want to look at algo-specific mortality by ward, it will show you here. You can select different period. Because this data is pulled from the MLCSU data warehouse, and we have only got access to Birmingham or Solihull data. And that's why I cannot calculate the wards for like other core cities, So I'm only benchmarking the weighted average, Birmingham weighted average. And you can see how many of these wards is like above or below the Birmingham average. Yeah. See. Yeah, this indicators pull from NDTMS, as you can see, it's from unmet needs. I know it's very messy, but it's the only way to show all the core city at once with different symbols. Yeah, you can select different time periods, substances, age groups. You name it, we'll have it. Then, yeah, I think the best part is also a tutorial. You can, yeah, if you don't know how, if you're the first time user of the Power BI dashboard, you can go through here. And we have a little like animation here to navigate you through how it's gonna work. Yeah. And that's everything from the dashboard.
Thank you, Chung. I'm just gonna nip back to the presentation, and then we will. Can everyone see my screen again?
Yeah.
Brilliant. Okie dokie. So, Georgia, do you want to take this slide? And we'll pick up more questions. Sorry, I have somehow pressed the wrong button.
Okay,
bear
I
with
can
me.
share mine.
Thank you. And I'll do the typing.
Yeah. Can I run see my screen?
Yes.
Cool. Yeah, so this bit is kind of about you giving us feedback on what you think of the dashboard and any kind of gaps that you might have identified from looking at it and from what Chung has just shown and from what we've talked about. So I don't know if anyone wants to jump in with any thoughts they have, or I'll give you a few seconds. You can also put them in the chat and I can read them out, and Candice can type them as well.
Is there a test site? So you've got one question in the chat from Samantha saying, is there a test site to use in order to provide feedback? Chung, are we able to offer that? I know it's not been published yet.
BCC colleagues will be able to access it, but if we want to share it to external organization, I might need to get some help from the City Observatory to publish a public link for other users.
Fantastic.
So you've got your hand up.
Yeah, I'm just wondering whether it would be worthwhile putting the front page of the dashboard up so that we can see the areas that the dashboard covers, if that's possible.
I've got it here.
Ah, yeah, thank you.
Yeah.
Thanks. Just wondering if there are any gaps in that. I've been through it personally and I haven't identified any gaps myself, but I think it might be quite useful for colleagues to see that.
Yeah, and if anyone wants me to jump to any specific chapter or any indicator, just let me know.
For those of sorry, someone was about to come in. Sorry, Michael.
Hi, sorry, I had computer problems. I'm the lead nurse for substance misuse and forward thinking Birmingham.
Fantastic, thank you, Mike. Did you have any questions? Could you see any useful data that would help you in your role?
I've just come into the meeting, so
I sorry. No, that's fine. Would it help for external colleagues if we could get screenshots to send across so you can review this in your own time?
Oh, that
Candice. I think that would be really helpful.
Okay.
I just had one question, Candice. Obviously, we're currently working with Aquarius. So would any data that comes from the Youth Justice Service come via them on this dashboard? Or how would we be contributing to it from a youth justice perspective?
If you are correct, so if they are in Aquarius and known to youth justice, if that is declared by the person, when we put that on, it would show on this dashboard how many numbers we have at a targeted level. So it wouldn't highlight the link to youth justice. However, that can be explored if we want to start including youth justice data in here and how we would combine it and show that impact. So
yeah, I think it would be really important to do that in terms of looking at the links, because already through the Youth Justice Service there is a big correlation between youth justice and substance misuse.
Yes.
So I think being able to obtain that data and reflect that and have youth justice as a category, particularly for our under 18s, I think that would be really helpful to do that, particularly when we're thinking about services going forward and thinking about preventative strategies for them inclusive of youth justice. Even though I know that they can gain access it through other doors, but looking at it through the lens of youth justice, I think it would be really helpful.
Thank you so much for that, Miranda. Thank you. That's a fair point. It'd be good to understand. Vic, it would be good to understand the data would be used to evidence the areas identify. Yes, that can be provided as well.
I was thinking in terms of like the world class.
Yeah.
Sorry, that was on the other side, wasn't it?
Yeah.
I think the first one and the third one, I can't remember about seeing it.
Yeah, the title World Class Recovery Treatment. We are under, I am reviewing that title. I know it is the national direction, national wording, but I think for those who maybe aren't in a treatment service, understanding what we are achieving by a world-class treatment and recovery service isn't the most helpful title. So I'm more than happy, Vic, for us to kind of have a think around that and how we display how that data is being used and making it really clear to everyone what that is. Don't want to miss any more questions. Sorry. Hi, Michael.
Hi, it's Mike, if that's okay.
Sorry, Mike.
Me off. So, I mean, from my perspective, so I've worked in CAMS for a long time, and I work with Aquarius that are awesome. Hello, Colette. And I think that the dual diagnoses, early dual diagnoses, diagnosis and treatment is really, really important, because I think the thing that we miss is you might focus on substances, but we're not collating enough data about the prevalence of mental health disorder, particularly trauma, mood, and neurodiversity. And that would also be the same in the youth justice, because I was a YOS nurse for 20 years. So we need that link to existing interventions around mental health that either sort of limit the recovery phase for young people who are engaging in substance misuse. Thinking about dual diagnoses would be really important, because diagnostic services and intervention services around medicines is really important.
Thanks, Mike. We do collect, I know from our CYP world, we do collect mental health, as you said, interventions, and we also collect baseline scores on their entry to treatment and their exit from. So it is something that would be within our gift. So I'll have a look at, I'll leave that for Chung, and we can pick that up as how we kind of tease that out. So thanks for that, Mike. That'd be fantastic.
I was also going to mention about the dual diagnosis, but I also know that there is already a strategy happening to look at that as well. So I know there's a separate piece of work in regards to that. So that's kind of why I didn't really raise it in this forum as well. But yeah, definitely agree with Mike.
Yeah, thank you. Samantha, is there any intersectionality data between drugs, alcohol, mental health? It's evolving. So there's the best way to put that. Intersectionality data, it kind of goes back to some, as what we're saying, some of the gaps in our data is that we can see it if they sit in a substance misuse service and they've declared that, or they have told their drug worker on it whilst they're in service, but we wouldn't have it from a mental health service if they've declared substance misuse there. So that is a gap in our data, which is quite correct, is that we don't have data coming in from mental health services that would help us build that picture holistically. So I think that's worth noting as well. Thank you very much. So would it be, I think we've got access to everyone who's on this call's email. So if you could give us probably till the end of next week, sorry. If you could give us to the end of next week to kind of make a PDF or a portfolio of the slides and then circulate it to the members of this. It will come from the addictions email box, so you can reply back to that, and we can take comments from there. Farat, hi, apologies if I missed anything. Any data links to HIV or hepatitis on the dashboard. Farat, your another fair point. At the moment, it isn't included because of the reporting into Fast Track City. However, we are reviewing that area at the moment and looking at what is it that we would like to measure and how we would evidence impact. I know our adult service do record and we are aware of their micro elimination targets and their compliance with. So we may need to have a look at that. And it is something of combining different data sets. So probably something I would take offline with you for it and maybe have a look at how we can do that ethically, because it's the combination of two different health sets. But thank you very much for that. That's fantastic. Carmel, data relating to pregnant ladies and geographical areas. Another very good point. We do have access to data to how many women and families are in treatment where they have a parental responsibility, but I wouldn't be able to see if they're pregnant. However, having Vic on the call, I might just ask, Vic, when somebody accesses services for the adults, do you record if they're pregnant? Or Kerry, sorry.
Yeah, we do, and we link in with hi Carmel. So we link in and we run a report on a monthly basis and review all pregnant service users within the service, and then we meet with the specialist midwives. But there are always ones that can fall through the gaps.
Yeah. So again, if the numbers aren't too small, again, Carmel, it's something that we could look at how we would evidence it and what kind of measure we're putting that into the public domain, but I can't see any harm in that. Homelessness, Samantha, yes, we do capture. We're just reviewing that data set at the moment to show how we would put that out and how we can evidence that for the best possible ways. So now myself and Georgia, we're reviewing the homeless data and substance misuse crossover. So yes, that can be something that we can seek to include. Councillor Scott, is there a link between the housing links to housing type across the board, including NFA, SEA, would be really useful to see. Again, Councillor Scott, we do have that data. We're looking at how we clean it and make sure that we show it as a value metric. And if we do show it as a value metric, what kind of targets we're going to set for the partnership to either increase or reduce as such. But it is also great feedback. So thank you very much, Councillor Scott. Mohammed, can we utilise the dashboard to inform local partners as part of community safety work to help address crime, ASB, associated with substance misuse? We have monthly dashboard featured at local community safety partnerships, which operational level professionals that from a geographical area attend. And I know, Mohammed, I've had just very early conversations with Pamela around certain issues around this. So again, it can be something that we can put into development. Sorry, I don't know if you were coming in. So yes, thank you for that. We can put that under for development area to see how we can again kind of capture that and visualize it so that, like you say, people can utilize it from the best to take away that evidence from it and plan their data accordingly. Is there any more questions? Don't want to rush anybody. Indicators of vulnerability also identified. Yeah, that's again another fantastic point. Now our indicators of vulnerability, Samantha, are identified because we're not a mandatory. Neither of our services are mandatory. We rely on people declaring it. Those who are under 25 or are known to be under safeguarding, we do lateral checks. And it would be there, but I know we do have it reported. So again, thank you for that development point. We will look at how we kind of bring that out for you so you can utilize it for its best. We've got such great feedback. Thank you everyone so much. If anybody is an analyst as well, sitting in another team and know where some of this data sits best, and wants to be involved in that and help us build it, please feel free to drop your email in the chat, and it will allow Chung to kind of work with you to help that data push and data flow. Thank you, Mohammed. If you could just link us in, that would be great. I said it'd be good to have workshops from Chung to display scenarios, ensure data is interpreted accurately and impressive work. Thank you. We're happy after we send this out to probably have another so we can review your points and how we can work together. I'd like to see this as a great push for those who have those analysts in their team and know that that combination to kind of start working together in this subgroup so that we can build this to its best. So again, if you are going back to a team and you know of an analyst that would be best suited to be coming to those meetings, please push for that person. We will send round the meeting dates for our data and evidence, and happy for some people to tie into that would be great. Thank you very much, Mohammed. We'll conclude then. Thank you very much for everyone who has attended. It's been really, really useful. We've had lots and lots of great feedback, and yes, we'll take this opportunity to build it from there, and try and get this out to everybody so that we can share. But what I'll do is make sure that the dates of the subgroup of data and evidence are circled to everybody. So if anybody had, like I say, has that analyst or a personal interest and can help us build real rich data going into that dashboard, they can come along and attend that subgroup because it feeds into the BDAP and it will help the development of the dashboard. So great. Thank you all very much.
Thank you.
Thank you.
Thank
Thanks.
you.
Bye-bye. Thank you.
Thank you. Thank you.
Take care. Bye.